cognitive behavioral therapy, I know that your podcast is called Think, Act, Be, and those are sort of the three parts of cognitive behavioral therapy, correct?
Well, the three parts of mindfulness-centered cognitive behavioral therapy.
Mm-hmm.
So the third wave of CBT has added this mindfulness and acceptance component.
Okay. So what are the three waves?
Well, so think corresponds to the cognitive approach. So that's when we understand our thoughts,
Mm-hmm.
the stories that we're telling ourselves, then it's easier to make sense of our actions and also easier to um, examine our thoughts and change them in ways that are going to be helpful to the way that we think, feel, and act.
Mm-hmm.
The act part obviously is the behavioral approach, so that includes things like looking at the ways that we're rewarded for certain behaviors, like when I don't go outside because my neighbor's out there and I feel anxious about talking to him, then I get a short-term reward from that. I feel relief, but in the long term, I don't have that close connection, and my fear stays stuck.
Mm-hmm.
So understanding those kinds of patterns can help us to practice new behaviors that can free us up and just lead to a more fulfilling life. And then the B part is mindful acceptance and mindful presence. So it's I think of it as the quality of presence that we bring to our thoughts and our actions. So in excuse me, I used to think of it as a kind of uh, third option in a way. Like we've got mindfulness approaches. Sorry, we've got cognitive approaches, behavioral, and now we can also throw some mindfulness in there if needed. But now I think of it more as the groundwork for all the others, that we can bring that type of presence to any other practice or technique that we're working on.
Mm-hmm. So how do you involve mindfulness or rather integrate mindfulness into CBT as a practitioner and help as a clinical psychologist, right? How do you help other people do that?
Right. So, I mean, a lot of it is about the spirit in which we approach our thoughts. So, uh, so we can practice brief mindfulness exercises right in session that will help to center us, to ground us, and also to open our receptivity to notice like what's going on in our minds, to increase awareness. That's so much of what CBT is about, and I think that's part of why mindfulness fits so nicely with it. It's really about increasing our awareness of our thoughts, awareness of our actions, so we can approach our thoughts mindfully. We can respond to thoughts mindfully. We can kind of recognize them with some distance, that we're not identical to our thoughts, that we can have a thought that's not necessarily true, that we don't even necessarily believe.
Right.
And same with actions. We can, if we're doing, let's say, some exposure, which is an important approach in behavior therapy. So that means facing the fears that I've been avoiding. We can do that in a mindful way, both in terms of the acceptance part, so accepting that it's going to be uncomfortable, that I'm going to want to flee, and I have a choice in whether I respond to that urge to flee or stay.
Mm-hmm.
And also bringing greater presence to that experience, and just allowing myself to be fully in it. So if I'm talking to my neighbor, just being fully in that experience. And when we come into the present, that's a pretty powerful way to get out of the grip of anxiety, because anxiety obviously is focused on the future.
Right.